sweet friends, and welcome back to the channel, or if it's your first time here, welcome especially. I'm Sally and I'm so glad that you've stopped by. In today's video, it is yet another deep dive. We are going to be diving into the great cholesterol myth, the great heart health myth as a whole, talking a little bit about high blood pressure as well, recognizing that these two things tend to go hand in hand. I want to identify the importance of cholesterol in the body. I want to talk about what does not cause high cholesterol, kind of bust the myths around saturated fat and sodium, and then I want to talk about what actually does cause high cholesterol. And I need to preface this by saying that there is a genetic component. There's no one-size-fits-all solution. There are things that we can generally do to optimize our heart health, but there will be outliers. They will be people who need a little bit more attention just based on, genetic factors, or maybe people who have just higher cholesterol or higher blood pressure, and they always have, and that's not necessarily a bad thing if it's a genetic factor. Maybe it does need to be addressed, but that's a great time to, work one-on-one with a practitioner. But first, let's talk about kind of the purpose of cholesterol in the body. Cholesterol is essential for so many different functions. Just to name a few, it is necessary for the synthesis of all of our steroid hormones. A few of our steroid hormones that you're probably familiar with are going to be progesterone, testosterone, and cortisol. There are many more than that, but all of those obviously are crucial. Even though we don't want our cortisol levels to be too high, it's also really problematic if we do not have enough cortisol. Cholesterol is also really important for the synthesis of vitamin D, our ability to synthesize vitamin D with sunlight. And as we've talked about in previous videos, vitamin D that we synthesize ourselves is much more powerful than any vitamin D that we are going to take externally. Okay, so what are the myths? What are the ideas that people have about what causes high cholesterol, what causes high blood pressure that are just absolutely false? These are all around sodium and saturated fats. So when it comes to sodium, there has been this long-standing medical advice, especially with high blood pressure, that we need to reduce our sodium intake. And I actually have some evidence right here that I want to read to y'all. This was presented in my nutritional therapy course. So as I'm pretty much reading off the slide, bear with me and understand that that's where this information came from. As reported in the New York Times, a study published in the Journal of American Medical Association in 2011 found that low salt diets increase the risk of death from heart attacks and strokes and do not prevent high blood pressure. So again, low salt diets actually increase the risk of death from heart attacks and strokes and do not prevent high blood pressure. That was published in the Journal of the American Medical Association. Furthermore, continuing on, the investigation found that the less salt people ate, the more likely they were to die of heart disease. 50 people in the lowest third of salt consumption, which were eating 2.5 grams of sodium per day, died during the study, as compared with 24 in the medium group, who were eating 3.9 grams of sodium per day, and 10 in the highest salt consumption group, 6 grams of sodium per day. And while those eating the most salt had on average a slight increase in systolic blood pressure, it was a 1.71 millimeter increase in pressure for each 2.5 grams increase in sodium per day. They were no more likely to develop hypertension. So no connection found between high sodium and higher risk of heart disease or high blood pressure. In fact, just the opposite. People who were eating too low sodium were dying more from heart disease. I also want to note that there's a big lack of understanding when it comes to sodium and potassium and the relationship between the two in the body. If someone genuinely is struggling with high sodium, being told that they have high sodium, I would encourage you, if this is you, obviously you need to, work with someone you trust. Hopefully you trust your doctor, but consider not decreasing your sodium intake, but rather increasing your potassium intake, because we do run into issues when those two are out of balance, and most people are not actually eating enough potassium or anywhere near enough potassium. Okay, so that's an aside. Let's talk about saturated fat. So there has long been this idea that saturated fat is bad for your heart. It causes heart disease. Red meat causes heart disease. Red meat raises cholesterol. And I want to say this and the whole sodium thing are based on a study that's, I believe, over 50 years old, and that has actually previously or since then been shown to be inaccurate and even dishonest in terms of how it was conducted. It's been debunked, and yet It has to do with lobbyists. It has to do with politics. It's obnoxious. This is the agenda that has been pushed even through mainstream medical associations, communities, is that sodium and saturated fats are bad. Here's the evidence on saturated fat. And it's talking about polyunsaturated fats as well, hydrogenated vegetable oils, so we're going to kind of address both points. But again, reading from the slides, the 1987 Harvard Nurses Health Study showed that the 1987 Harvard Nurses Health Study of nearly 90,000 women showed that margarine was associated with a 50% increase in heart disease, up to 70% with over 4 teaspoons. Meanwhile, butter, beef, pork, and lamb, all high saturated fat foods, those are red meats or dairy products that have been coined bad for heart health, did not increase heart disease risk. However, cookies and white bread, those refined, isolated carbohydrate sources, did. They did increase heart disease risk. Additionally, the high consumption of hydrogenated vegetable oils, think processed PUFAs, raised serum cholesterol levels. Okay, so that's the evidence pretty clearly laid out. This is a very reputable study. Again, the sample size of those Harvard Nurses studies is just massive, and I believe they're also conducted over a relatively long period of time. It is showing that processed vegetable oils I had a tickle in my throat, that processed vegetable oils are more connected with high blood pressure, high cholesterol, heart disease than saturated animal fats actually are. So let's get into the reason of why this actually is the case. And we're going to be talking about two things. There are kind of two reasons behind it, but they play off each other. Those are going to be inflammation and stress. And I do first want to make it very clear that for most people, dietary cholesterol does not increase serum cholesterol levels, at least significantly. In most people, there's no direct relationship. Our body is going to produce as much cholesterol it needs. The question is whether or not we are supplying it with the necessary building blocks. And if we're failing to supply it with the necessary building blocks, it's actually just going to be more stressful for the body to create the cholesterol it needs to manage that properly, and therefore we can actually see an increase in problems with the heart because of that stress, which is what we're getting into. So again, stress and inflammation, those two play hand in hand, because when we are stressed, we see an inflammatory response. And I want you to remember that stress isn't just a reaction to an external stimulus necessarily. It's not like, oh, you just have to have a lot going on and that's making you stressed out, or some traumatic event. Those are all very valid causes of stress, but one of the biggest stressors that most of us endure on a daily basis has to do with nutrition and how we're nourishing ourselves. A massive thing that I've talked about previously, go watch my blood sugar balancing video after this and we'll talk about it in more depth, is blood sugar. If our blood sugar is chronically imbalanced, if this is something we're struggling with, our cortisol levels are chronically higher, we're experiencing chronic levels of stress, and that is going to increase inflammation. When our cortisol levels are elevated, cholesterol levels elevate. And this is kind of like our body just trying to do its job. It is almost a protective response, but when that protective response is not operating within the appropriate parameters, when we are not cultivating an environment where it can operate within the appropriate parameters, and it seems like it has to happen pretty much all the time, that's when we run into an issue. So when our cortisol levels are too high, we are going to see cholesterol levels raising as well. That is inflammation. That causes inflammation, cortisol levels being high. You see a big connection there. And then those processed carbohydrates, like when we said that there's a link to white bread and cookies, people are eating those super refined carbohydrates, especially in isolation. That is what's driving the crazy cycle for many people, that lack of blood sugar balance, blood sugar dysregulation, especially chronically, that is causing chronic stress on the body. Again, if you want to learn more about that, go check out my video on blood sugar dysregulation. I'll make sure to link that below so you have easy access to it. The other piece of the puzzle has to do with the fats in our diet. If you watched my video on the mainstream diet myth that is slowly killing us, again, it's on polyunsaturated fats, I will also link that below. You will learn about how polyunsaturated fats, especially when they're really refined in their processed forms where they are lacking vitamin E and the necessary antioxidants to balance out the free radicals that they produce, the oxidation they produce, that causes inflammation in the body. PUFAs are one of the main contributors of inflammation, and that ties to overall fatty acid balance. So when we do not have the right ratio of fatty acids, we do not have the right ratio of prostaglandins, and that causes inflammation, once again causing high blood pressure. And for most people, or causing high cholesterol. And for most people, the issue there is that we have too many PUFAs, we don't eat enough saturated fats, and the animal foods that we are eating, the saturated fat sources that we are eating are not from good sources. So there's a big difference if you're eating meat and dairy products that are grass-fed versus ones that are conventionally raised, eating a lot of grain. The fatty acid profile is going to be completely different. Also, oftentimes people are going to have a problem with their omega-6 to omega-3 fatty acid ratio. You need both. Your omega-6 levels are actually supposed to be a little bit higher than your omega-3 levels, but by a relatively small degree. I want to say it should be like a 2 to 1 degree ideally, or ratio ideally. And a lot of times it'll be like astronomically higher than that. People are getting a ton of omega-6, but not enough omega-3. So go check out my previous videos on fatty acid balance, PUFAs, to learn more about that. But understand this is what is happening when our cholesterol levels are elevated. When we are stressed out for whatever reason, it causes inflammation. Or when we are inflamed for whatever reason, okay, that inflammation is present, cortisol levels are elevated, you're going to see cholesterol levels in the blood increase. That's the body trying to do its job. When that happens is when we start to see those issues with chronically high cholesterol, maybe heart disease, maybe risk of heart attack increasing, all that stuff. So if you have questions, please leave them down below. I've done my best to kind of go through this pretty succinctly. I know it's a complicated topic, but my hope with this video is that you see it's not actually quite as complicated or scary as it's been made out to be. It's quite simple what's going on. And hopefully in understanding the process behind it, you won't be maybe afraid to eat foods that you have been fear-mongered into not eating. So thanks for being here. Please don't forget to subscribe, and until next time, bye y'all.